Hello, I'm Dr. Marty Ross, and in this video, we're going to talk about coronavirus and Lyme disease. I'll cover information about Lyme disease immune suppression and whether or not that puts you at greater risk. We'll talk about ways that you can support your immune system that may help you. I describe what to do if you should get an infection that could potentially stop virus replication. And then finally, we describe ways to block cytokines to prevent cytokine storm that leads to lung damage. If you need more information and more details, read the full written article that I've written about this. Treat Lyme is supported by purchases you make through Marty Ross MD supplements.
People with Lyme, there is an opinion that people have immune suppression with Lyme. And there's a concern that people have with Lyme that may make them into one of the high-risk groups, okay? So we know that people that tend to do worse with COVID-19 are people that have underlying heart disease, have underlying lung disease, have diabetes, have some immune suppressive illness, like various rheumatoid arthritis and things like that, okay? And so therefore, people with Lyme who basically have concerns about immune suppression because they have Lyme living in them, and obviously their immune system hasn't done a good job getting rid of Lyme. So there's an opinion that people have that they have an immune suppression that may make them at higher risk for COVID-19 and coronavirus. And what I would say to you is that's probably not true. Although the immune system in Lyme has been manipulated in a way that allows Lyme to survive, that doesn't necessarily mean that that means you have a broad immune suppression that's going to make it difficult for you to deal with coronavirus, okay? And in fact, I was listening to a recent webinar that had people on it, like Dr. Richard Horowitz, Dr. Steve Harris in California, Dr. Schwig, and others, and they were basically saying the same thing. So it was nice to hear other people confirm my opinion as well, too. What I will tell you, though, is that there are some people with Lyme that do have broad immune suppression. And so one way to look at this is if you're the person with Lyme that generally recovers from viruses like the flu and other things relatively easily, you probably are not somebody that has broad immune suppression, okay? But if you are the person with Lyme that every time you get a virus infection, it takes you forever to recover, or you get hit with the flu harder than everyone else, or you're the person with Lyme that picks up every virus infection that comes along, then you might have some immune suppression, which could make you at greater risk. The truth is, we don't know. No one's done the research on this, okay? But I want to just dispel the myth that everyone with Lyme has immune suppression that's going to make them at risk for coronavirus. That is not true. Most people with Lyme can tolerate flus and don't handle them any worse than anyone else does, for instance. Therefore, it's probably true that most people with Lyme do not have a type of immune suppression that's going to make it harder for them to deal with coronavirus. Having said that, as I just said, there are some people with Lyme that do have a hard time with viruses when they come along, that tend to get every virus or tend to have bad outcomes every time they get a virus. In those people, there may be some immune suppression that may make it harder for them to deal with coronavirus. Okay? All right. So when we talk about the immune system and coronavirus, I want to make a distinction between two parts of the immune system. There's one which is called the innate immune system, and another part of our immune system is the adaptive immune system. All right, the adaptive immune system is the part of the immune system that at some time in your life has already had to deal with the infection or a similar type of infection. So for instance, when you get the flu each year, it's the adaptive immune system, which is made up of your T white blood cells and your immunoglobulins and that part of the immune system, and your B cells or your B white blood cells, all right? And so it's seen the infection before, right? The innate immune system is the part of the immune system that has to fight germs that it has never seen before, all right? So that's what we need to engage. If we're going to do something to boost our ability to deal with coronavirus, we need to be talking about the innate immune system because none of us has ever seen it before. That's why it's called the novel coronavirus. It's a new infection, okay? All right, now your innate immune system is made up of your skin, all right, made up of your mucous membranes, and it's made up of a variety of cells. One of those cells are natural killer cells. Another group is called macrophages. Mast cells are part of it. Something called phagocytes are part of it as well too, and another cell called a dendritic cell, okay? So we wanted to work with things that specifically will boost those, all right? Now, one comment, you mentioned NK cells here, and you mentioned that your CD57 is low. So CD57 is one kind of natural killer cell, and it is often low in people with chronic Lyme. That does not mean all of your natural killer cells are low, okay? In fact, if you were to study most patients with low CD57 counts, they actually still have normal natural killer cells. The only way you would really know if you have low natural killer cells is your doctor, in addition to checking your CD57 fraction, would actually have to measure your natural killer cell totals to see is your natural killer cell levels low, okay? All right, so what do you do to boost your innate immune system? Well, number one, vitamin A has been shown to actually increase the balance of, or actually been shown to increase your mucous membrane's ability to keep germs out, okay? So I usually like recommending vitamin A, 5,000 international units a day. Keep in mind, if you get above 10,000, that's where you start getting into vitamin A toxicity issues, okay? Number two, what has been shown useful at preventing and decreasing effects of all kinds of respiratory viruses is vitamin D. And I usually like to have people get their vitamin D levels so that they're somewhere between 50 and 80. One way to do that is to be on 5,000 international units a day. There's been good studies from the flu that shows when people have adequate vitamin D levels, that they have 50% less symptoms than people that don't, okay? Now, will that correspond to what happens in coronavirus? I don't know. We've never studied it with vitamin D, but there's a good chance it will, okay? One substance that can help your natural killer cell function is to take a product called transfer factor multi-immune, which is manufactured by Research Nutritionals, which is in great undersupply, okay? The Research Nutritionals, unfortunately, has had a run on that product. And although I periodically get it in, they're only allowing me to get about 48 bottles every week. And so if you go to my website, you'll find right now I have it. But I don't know how much longer I'll have it. I have another supply coming in on Friday, so we'll see, okay? But what their product has been shown to do is to increase your natural killer cell function by 600%, okay? That doesn't mean it actually necessarily increases the amount of natural killer cells, but it helps them work better by about 600%, okay? So natural killer cells are part of your innate immune system, all right? The other thing that could be useful is to be on mushrooms. And in particular, I like reishi mushrooms. And the reason I like mushrooms is that they contain a sugar called beta-glucans. And beta-glucans are shown to increase the function of your natural killer cells, of your macrophages, your dendritic cells, and your phagocytes, okay? It increases the function of all of those, all right? A good dose of the reishi gano is 400 milligrams 3 times a day. Okay, now again, even though it increases your innate function, I have no proof it's going to work in coronavirus, but there's a chance it can, okay? All right. The other thing you want to do that specifically helps your dendritic cells work better is to raise glutathione in those cells. And there's 2 ways to do that. You can use either a glutathione. You can take like a Trifortify orange or a Trifortify watermelon, which is liposomal glutathione by Research Nutritionals. And if you were to do that, 1 teaspoon a day could be helpful. Or you can raise glutathione by being on N-acetylcysteine, which is a product that helps increase your cell's production of glutathione, okay? So all of those things that I just said are things you can do to boost your immune system, the innate immune system specifically, okay? All right. Both Plaquenil, which is hydroxychloroquine, and chloroquine are antimalarial drugs, okay? They're quinine derivatives, basically. What they do is they bind zinc and they help carry it inside of cells, all right? So they are what are known as zinc ionophores, all right? They help get zinc to the inside of cells, all right? Now, zinc inside of a cell that is infected with coronavirus, zinc is an effective agent that blocks the function of enzymes that help in replication of the coronavirus. In other words, if you have a lot of zinc that gets to the inside of cells infected with coronavirus, it has a hard time replicating and therefore it can't survive. For the virus to spread, it needs to replicate. For the virus to infect us, it needs to replicate, okay? So the way that hydroxychloroquine and chloroquine work is by helping bind up zinc and getting it to the inside of the cells so that in the cells then zinc can decrease viral replication by interfering with the enzyme that controls that, okay? Now, you cannot just take zinc at high levels and expect that it's going to get in your cells. All right. So, I've been asked, for instance, well, if I just take a lot of zinc, is that going to work as well? No, you need to get it in the cells. Okay. That's the key part of it. Okay. And what does that are zinc ionophores. All right. Now, there are studies that are telling us out of France, and there have been more recent ones coming out of China regarding these ionophores, hydroxychloroquine and chloroquine. And the first study that came out of France about a week, 10 days ago, that resulted in our president saying that this was the new wonder drug, basically showed that people that had been given, in a very small study, the people that had been given the hydroxychloroquine and chloroquine basically had a decreased viral shedding from their noses, okay, suggesting that it might work. That still doesn't mean decreased viral shedding does not mean it's actually going to help people feel better or get well more quickly. A more recent study that has not been published yet, but I have seen pre-publication versions of it out of China, I believe, is now showing that people get, by being on a hydroxychloroquine, will actually get to having lower temperatures more quickly than people that don't. And I believe the other outcome, there was another clinical outcome that they looked at that shows that people actually do get benefit, all right? I still think at this point, although I would recommend if somebody gets infected with coronavirus that they use a hydroxychloroquine, that they use a Plaquenil. I still think the jury is out as to whether we're going to see broad help from people being on it. But I think in this time when we don't have many other things to use, I do think it's a good idea, okay? And if I were to do it with somebody that had an infection, what I would do is the hydroxychloroquine, which is Plaquenil, and I would do it as a 200 milligram pill. There's different ways to use it. You can either use it as 200 milligrams 3 times a day, or you can use it as 400 milligrams twice a day on the first day, and then you decrease it down to 200 milligrams twice a day after that. I would use zinc with it, and I would probably use zinc sulfate at about 220 milligrams one time a day so that you increase zinc intake with it too. The other thing that the French have shown in a very limited study is that combining that with the Zithromax resulted in improvements for people. And we're not quite sure why that is. It may be that it's helping limit secondary bacterial infections, okay? All right, now, here's the other part. So remember I said the way that hydroxychloroquine and chloroquine work is that they're ionophores, all right? Cryptolepis is not an ionophore, all right? So I don't think it's going to work. But there's an interesting product that has some ionophore potential based on laboratory experiments, and that is a bioflavonoid called quercetin. Okay, quercetin. Right now, quercetin, because this has now become published, is a hot item and it's hard to keep it in stock anymore. So if you go to my store, you're going to see I'm out of it probably until next week. But I'm starting to look at quercetin, and I'll be writing about it in my article when I update it tomorrow. Quercetin is interesting in 2 ways. Quercetin is an ionophore, so it can help get zinc inside the cells. There's also limited research from when the SARS epidemic happened a number of years ago. SARS was a coronavirus, that it decreased the infectivity, the ability of the virus to get inside of your cells, as long as on lab experiments, it showed decreased infectivity as long as those cells were coated in there was quercetin introduced to the cells before they got infected, okay? So it is possible that being on quercetin may help get more zinc inside your cells to decrease virus replication. It's also possible, based on petri dish and lab experiments, that it will decrease the ability of those viruses to even infect the cells as long as you're on it ahead of time. Okay, you have to be on it ahead of time. There is some laboratory experiments that suggest quercetin may also be antiviral against it as well, too. In other words, can kill it outright, okay? All right, so if you're looking for a way to do an ionophore to get zinc in, quercetin might be an option. I have no idea what the best dosing is on it, but when I'm using quercetin in my Lyme treatments to lower inflammation cytokines, the way that I'm using it is to have people take at least 500 milligrams 3 times a day, which is usually you're going to find quercetin as a 250 or a 300 milligram pill. Okay, all right, all right. One other word about yeah, anyhow, so quercetin is something if you're wanting to make sure that if you want to take something that hasn't been proved to work in Lyme, hasn't been proved to work in coronavirus, but has the potential based on laboratory experiments to help. Quercetin is something you might start taking before you get infected with coronavirus because it would decrease the infectivity and would help bring zinc into your cells so that if it is there, it decreases the virus replication as well too. Okay. One other thing about quercetin. People right now that are having bad outcomes from coronavirus are people that are developing severe acute respiratory distress syndrome. Okay. And what is leading to that acute respiratory distress syndrome, research is starting to tell us, is that people get into what is known as a cytokine storm. All right. Now, you guys that with Lyme are familiar with this idea of cytokines. The rest of the world is not, all right? One of the reasons people feel bad in Lyme is that their immune systems make too many cytokines. And there is a condition in Lyme, when you're treating Lyme, when you start killing a lot of Lyme, you can trigger a Herxheimer reaction. Well, that's a cytokine storm, okay? When you kill Lyme, sometimes you can trigger an excessive release of cytokines. And in an extreme, in coronavirus, that cytokine storm is resulting in lung damage and is actually killing people, okay? So one of the ways to potentially prevent getting into that situation is to block your cytokine production, all right? And guess what can do that? Quercetin, all right? So quercetin is an antioxidant that can lead to decreased cytokine production. Quercetin is a kinase inhibitor, it blocks enzymes that lead to cytokine production. And quercetin also interferes with the functioning of a genetic molecule inside of cells that produce cytokines called NF-kappa B. So it has broad potential to decrease the type of cytokines that may lead to the lung damage, okay? So you'll see me write this in my article tomorrow, but one of the new recommendations for people that want to try something that has no scientific proof that it works in this illness, I need to be clear about that, but there is a potential it could help, is quercetin. And it could help in a number of ways. Number one, it could be a zinc ionophore, all right, to help get zinc in to block virus replication in your cells. Number two, it itself outright has the ability to block infectivity of the coronavirus. Number three, it could kill coronavirus potentially based on research on an earlier version of coronavirus called the SARS virus, okay? And then finally, number three, quercetin has the ability to limit these, block cytokine production. Therefore, it may block the cytokine storms that are currently getting people into trouble and damaging their lungs, resulting in them dying when they have coronavirus, okay? And my recommended dosing on it would be to take 250 to 300 milligram pill, at least 2 pills twice a day, preferably 2 pills 3 times a day, okay? Those are just some thoughts. Again, the research has not been done in this coronavirus, okay? But it is something I'm starting to look at and will be writing about in my article when I update it tomorrow. All right? All right. Hello, Lindsay. I'm curious about the cytokine response in Lyme and babesiosis and how that is related to what they are describing as happened to people's lungs who are infected with coronavirus. All right. So, Lindsay, I answered that earlier, but basically, just real quickly again. So, in Lyme disease and in virus infections, the immune system gets triggered to make cytokines. At correct levels, cytokines are good. They turn white blood cells on to fight infections, and they help draw those white blood cells to where the infection is, and they help them work better, okay? But in Lyme, you can have cytokine excess. And a case of severe cytokine excess would be something called a Herxheimer reaction, which is a cytokine storm. Your immune system sees dead bug parts and releases way too many cytokines that can injure you, okay? In coronavirus, what we're seeing is that there's a subset of people that get into respiratory failure, acute respiratory distress syndrome, and that appears to be related to excess cytokines, specifically something called interleukin 6. There may be other ones as well, too, okay? And so that's an extreme cytokine storm that is interfering with how the lungs function and actually damaging the lungs, all right? And so it is possible, the studies haven't been done, that the steps we take as part of Lyme treatment, that I take as part of my Lyme treatments to block cytokines, may be beneficial to somebody if they get the coronavirus, if they're already doing things to block cytokine production. It may limit the severity of their respiratory syndrome. It may, okay? We don't have studies to know that, okay? So the things I recommend for my Lyme patients to lower cytokines, again, may lower cytokines and prevent some of these storm situations in COVID-19 and coronavirus. So at a minimum, I would do, again, quercetin, because it also may have antiviral properties. It may help get zinc inside of your cells to limit virus replication, and quercetin lowers cytokines, all right? And that would be 250 to 300 milligram pill, 2 pills, 3 times a day. I would do curcumin, 500 milligrams, 3 times a day. And I would also be on glutathione, which through various mechanisms also can lower cytokines. And I would do a Trifortify orange or a Trifortify watermelon by research nutritionalists, because they have science that proves it actually is absorbed well. And I would do 1 teaspoonful of that 1 time a day. That would be my anti-cytokine formula that I use as part of my Lyme treatments. And I suspect it would be helpful if you happen to get COVID-19, but I have to give a big disclaimer here. Who knows? The research hasn't been done, okay? All right. Thank you for that question, Lindsay.